Okay, next is Dr. Edward Drass.
Good morning, Board. I'm Dr. Edward Drass. I've practiced here in Florida for the last 40 years. I've done general internal medicine and family practice. I also chaired our hospital ethics committee for 12 years. Today, I loudly speak out against all forms of chemical and surgical cross-sex therapy. I've seen the full range of mental illness in children, adolescents, and young adults. We all agree mental illness is destructive for the individual, the family, and for society. Many of the individuals that I've seen that are LGBTQ or transgender have significant levels of mental illness. And often this mental illness has not been satisfactorily addressed by counseling or psychotherapy. Is it not the best practice to address psychopathology with approved psychotherapy before instituting life-changing, unhealthy transition treatments? Gender identity disorder only came to my attention 5 or 6 years ago, but it's now diagnosed in the code book for mental illness, the DSM-5, as gender dysphoria. It appears that we're dealing with an unprecedented epidemic of mental illness in adolescent females. This demographic comprises the bulk of the 4,400% rise in new cases of gender dysphoria seen in the past few years. So I ask you physicians, for what other disease do we allow an adolescent patient to make his own diagnosis and then demand a preferred treatment? As the Board of Medicine, what ethical standards must be met when providing sex reassignment? What standards of care have been established for this treatment? Does the board supervise quality control and satisfactory outcomes for doctors and clinics offering these services? What is a satisfactory outcome? These are all questions that need to be asked when you decide the rules for transgender treatment. I think other countries and judicial systems are well ahead of the United States in making this determination. In the wake of the Bell versus Tavistock verdict, as you heard from Dr. Biggs, the NHS has reversed course in its transition treatment advice. Florida should take the lead from this decision. A summary review of transgender medical research concludes there's no support for medical intervention for gender-confused minors. Medical transition procedures do not reduce youth suicide. Childhood gender dysphoria usually dissipates by adulthood, and the dramatic increase in gender dysphoria in the recent past is likely driven by social factors. My recommendation to the Rules Committee is that cross-sex medical and surgical treatment should not be supported by organized medicine, the Board of Medicine, the legislature, or insurance companies. Thank you for what you're
Dr.
doing.
Drass, thank you so much.
I'm going to ask the crowd to please be controlled. What we're trying to do is allow everybody to make comments. So please contain we've got to control this so that we can allow everybody to have their time.